Hi, my name is Stephen Lyford, and you've tuned in to a new episode of Migraine International Patient's Perspective. Today's topic is what migraine sufferers need to know about stroke. And we're using an article that is by the American Heart Association as our basis, and we're going to add our own commentary. But I wanted our audience that we know um, that usually tunes in to think about the fact that as migraine sufferers, we need to be aware that we're at a higher risk of stroke. And when I saw this article, I thought it would be a good idea to bring this to you because I know a lot of us don't really think about the fact that stroke is a really real risk for migraine sufferers. Um, and especially for women. And I'll get to why that is in just a moment. Um, it does occur, and there have been many studies on this. And what they're saying in the article is that more studies need to be done, um, and that many physicians say that migraine with aura is associated with a doubling of that risk. Now, what is migraine with aura? Migraine with aura is when you have, prior to your migraine, you have visual disturbances such as flashing lights, zigzag lines, um, and a visual disturbance in one eye, and that's followed by your migraine. Um, Now, they suggest that to diagnose that, when if you have a first episode, if you've never had that before, and you have those symptoms, you should contact the ER or get to your doctor to rule out a retinal tear or a TIA, which is like a mini stroke. The retinal tear can be ruled out by your ophthalmologist through an eye exam. The TIA, you could have a head CT or an MRI. Now, when I was reading about the aura, one of the things that they talk about, if you have migraine with aura, since it is a pre-indicator that migraine is coming, um, you should take your preventative medications immediately while you're having the aura to prevent the pain from coming. Um, at the first sign of the aura, you take whatever pain medication that your doctor recommends or that you normally use to get rid of that pain. Because if you can prevent the pain from coming, period. Because once it's there, it's already too late. So, and in the article that was talking about aura, um, they're talking about things like preventive medicines. Also, they want you to control your blood pressure. Um, they also talk about taking antidepressants as preventative, anti-seizure medications like Topamax, Botox, which I'm not a big fan of, and CGRPs, which would include Emgality, Ajovy, and the other main one, it's slipping my mind right now. And I'm sure all of you will comment and tell me the one that I'm forgetting. And for migraine with aura, they also recommend stress management. I'm sure this would work for for migraines as well. Stress management and lifestyle management. Um, they recommend at the first sign of a migraine, for those of you with aura, and I think this would work with regular regular migraines as well. Um, First signs of a migraine: get quiet, get dark, get cool. In other words, get to a cool, dark room, get some ice, like an ice pack, and I've mentioned this before. Get a routine. Um, your sleep time should be the same every day, even the weekends. If you sleep 6 hours, 7 hours, whatever it is you do, don't increase that on the weekends, because that's going to bring on an oversleep type headache. If you exercise, keep that up even on the weekends. If you don't exercise, you should. Um, get a food schedule. Eat the same amount, same times every day, including the weekends, because that food schedule can throw you off, throw your blood sugars out of whack, and you want all that stuff to be consistent. Um, and boy, I can't even read my own writing, so we'll skip to the next thing. So, you get back to the first page here. So 30 million Americans in the United States suffer from migraines, which is a recurring throbbing headache that can be debilitating, accompanied with nausea and weakness. And they talk about one more thing. With the flashing of light and zigzag lines associated with the aura, it can also give you difficulty speaking, which I've had a couple of severe headaches that I thought maybe they were cluster headaches, but they gave me difficulty speaking as well. Those were my level 10 headaches. 3/4 of migraine sufferers are women. Of the roughly 800,000 strokes suffered each year in the United States, the American Migraine Foundation estimates that 2,000 to 3,000 of them are linked to migraines. And they say the link here is that it likely is linked to their arteries. And migraines involve a spasm in the artery. And that's from a study at Brown University. And they're saying that sometimes with women, it can be linked to oral contraceptives, and those can increase the risk of blood clots. I'm glad I don't have to worry about that. If you constrict the vessel, you reduce the flow. If you're on hormones, that increase the risk of clotting, and the vessel goes into a spasm, and you're more likely to form a clot, and that can cause a stroke. Strokes occur much more frequently in older people, while the occurrence of migraines often declines in people when they get older. And I'm getting older, so maybe I'll get lucky and I'll get rid of my migraines. If you suffer with migraine with aura, you should make your healthcare providers aware of that. So that they'll know how to treat you and reduce your risk factors. And reduce your risk factors for stroke. So, if you have migraine with aura, since it does increase your risk for stroke, you need to control certain things. Like smoking. You need to stay active. Don't abuse alcohol. Control your weight, your blood pressure, your blood sugar, your cholesterol. And like I said before, the oral contraceptives. All of these are red flags that can affect your health. If you have infrequent headaches, if your headaches are just going along, you have one occasionally, and then all of a sudden that pattern changes, that's a reason for concern. it can be an indication of a new problem. You could be developing a blood clot in your brain. And those are things that you need to make your doctor aware of, your neurologist especially. And you should be concerned that you might be at an elevated risk of stroke. Now, migraines are also an increased risk factor of heart disease. So they really don't know why that's the fact. They're trying to do more studies on that as well. But my friends, as migraine sufferers, for us, consistency is the key. We have to eliminate as many risk factors as we can. Caffeine, alcohol, blood sugar, all of those things that mess with our body's regular, the regular machinery in our body. Because it gets us, if we get a little bit out of whack, it can change the sensitivity in our head. So I guess what I'm saying is, I've said this before, a migraine is basically a hypersensitivity of the nerves in our brain. And anything that upsets the apple cart causes our brains in our head to hurt. So whatever we can do to balance that is going to help us out. So if we can stay away from stimulants of any kind, which means caffeine, sugars, drinks with red dye, alcohol, any kind of foods that cause us problems like that. That gets back to our triggers. So you have to work on your triggers to see what they are, and the only way to do that is to, when you have a headache, go back and look at what was it that you ate? What was it that you drank? Did you eat too much? Did you not eat soon enough? We have to be diligent about, using your Migraine Buddy app. Was it the weather? Was it the barometric pressure? Unfortunately, it's a lot of work for us. Was it anxiety? Was it anger? We have to keep our emotions in check, that so that we don't increase the internal pressure in our head. So I hope this was a little bit informative for you. I just wanted you to be aware that stroke is another thing that we have to mitigate with our migraines. And if you have any risk that you're uncertain of, please talk to your doctor. And the next episode of the Migraine Buddy group, or not Migraine Buddy group, but the Migraine International Patients Perspective, I want to do an episode about the Migraine Buddy app. I've been trying to get someone from the Migraine Buddy app to come on with us. Unfortunately, he was not available due to a migraine. But he's already agreed to come on with me. But we just haven't been able to line that up. So I think what I might do is a tutorial for the app, and to explain some of the functions, sort of a live tutorial. And then we'll try to get him on after that. So this has been Migraine International Patients Perspective, episode 10. what migraine sufferers need to know about stroke. My name's Stephen Lyford. Thank you for watching.